we've also, we've discussed the fact that non-adherence is a major contributor to relapse. And so I want to ask Dawn to give us, your thoughts about this whole issue. I mean, what factors influence treatment adherence, and how do you monitor it, and how can you increase adherence in patients?
Well, I think monitoring it is the first thing that I wanted to talk about. I have no idea how an outpatient provider who sees a person who's not doing well with schizophrenia decides what to do. Do you add something? Do you switch it? Do you change the dose? Without information on whether that person is taking the medicine as you prescribed it, you really don't have a clue about what to do. And so it's very difficult to tell if someone's taking their medicine. We did studies where we went to people's homes and counted their pills right in front of them. And they would all say on a scale from 1 to 5, 5 being 100% of their medicine, they circled the 5. And they could see we were counting their pills. And so they intend to take medication, but sometimes it doesn't work out. And there are a lot of reasons why people don't take medication. So you have a group of people who will tell you, I'm not taking any of that stuff. And they need a certain kind of intervention to work with that. But most of the people are taking some of the medicine some of the time. And the issue is how they choose to take what when. They may develop ideas about side effects. So I've had people tell me that, oh, that medicine makes my knees hurt. And it turns out they started walking more or running because they felt better. And it really isn't the medicine that's causing the problem. So perceived side effects can be one reason. It's also true that I have people who are really willing to take medication. They just aren't good at it. So they'll tell me things like, oh, Dr. Villigan, I know I'm supposed to take medication every night, but it's all the way over in the kitchen and I was already in bed. And so I missed that dose. Or they'll tell me that they think they're taking it, and I come at the end of the week and there's a bunch of days where their medicine's still in the pill container. So they're just not realizing. They may be intending to take it, they're on their way to the kitchen to get their medicine and the phone rings, or they see their dog and it distracts them and they think they've taken it, but they haven't. And literally, when we go to people's houses, we find bottles and bottles of unused medication. And I think that somebody, I think it was Haynes, said a long time ago, and the World Health Organization recently requoted him, that if we could improve medication adherence, that would probably be better than almost any advance in medication that we could come up with if people just took the stuff that we have. And so it's a really big deal. Now, in research, there are all kinds of ways to see if people are taking their medication. We can have pill containers that record when the drawer is open and ask them, did you take it just now? We have, we can count their pills, we can draw their blood, but none of the methods really tells us how much medicine got into the person. So with long-acting injection, we find that if people don't show up for their visit, hey, treatment non-adherence just started. And we're able to then address that immediately. If people don't come for their shot, we know for sure that they didn't take their medicine. We really don't have a good way to find out if people are taking their medicine on a daily basis in a clinical practice. So it's really a lot of guesswork. We go to people's homes and count pills. You'd think this would be easy, right? You count 1, 2, 3, or you count by twos, it goes twice as fast, and you'd think that would be a really easy procedure. But we go and new bottles show up and bottles disappear and people are taking out of multiple bottles. So it's much more difficult even to do something like that. So I really think we don't know how much non-adherence is out there. And if we just think about ourselves, I really don't think any of us take every dose of medication that we're prescribed. We all have those 2 or 3 antibiotics left over in the bottle after we've been taking them for an infection and we feel better, so we forget. So I think that it's very difficult to know if people are taking it. but it's so important to make sure people are getting consistent medication. And it's a real risk to just give people pills and expect them to do what we said.
And you know, Don, whenever I see a patient with schizophrenia for the first time, I immediately assume that this patient is not going to adhere, because non-adherence is so prevalent, so ubiquitous in this serious brain disorder that, and with multiple reasons, that you have to really be extremely vigilant about it, and not only talk about it to the patient, but you have to basically resort to some objective measures of whether they're taking it or not. Not just pill counting in the bottle. We tell the patients to bring the bottle every time, but also maybe even measuring serum prolactin to make sure that they're taking it. That helps a little bit. Maybe even asking a significant other if they live with anybody. Early on in the illness they do. But the reason they don't adhere is well known to us. There's lack of insight. The patient doesn't believe they're sick. They don't believe they need the medication. That's a huge challenge. They also have cognitive difficulties, which you're an expert at as a neuropsychologist. They have severe memory difficulty, one of the highlights of patients with schizophrenia. They forget much more than we normal people do, and we do sometimes. They have negative symptoms, which includes apathy, amotivation, avolition, inability to initiate an action. And then there's substance use. 70% of my patients are taking substances because I do urine screens for research purposes, and I lose 7 out of 10 patients because I can't put them in a study. So you really think somebody who is drunk or stoned is going to take their prescription medication? When you put them all together, it is a recipe for disaster. And that's why so many of our patients relapse right and left. And all it takes, by the way, according to studies published in American Journal by Sabatnik and his colleagues at UCLA, published a few years ago in American Journal, where they measured the blood level with every visit after discharge from the hospital. And they found out at the end of the year that all it takes is a drop of 25%. 25%, and they've relapsed. That tells you how brittle and fragile our patients are with schizophrenia, and how ensuring 100% oral adherence is almost impossible in a majority of the patients.
I think that's very true. I think when you don't work and go to a job every day and get up at the same time and take a shower and brush your teeth, you do not have any habits to tie medication taking to. It's sort of like being on vacation. You don't remember to take your medication as easily as you do when you have a regular routine. And many of our patients with schizophrenia don't have a regular routine, so they can't really remember to tie medication to anything they do every single day. So it is really a risk. I agree.